Let's discuss colposcopy. This is an outpatient test to look at your cervix in detail to check for abnormal cells. It is done using a special microscope called a colposcope that resembles a pair of binoculars. What the test involves. You may be sent for a colposcopy if your cervical screening test has shown abnormal cells. If your cervix looks abnormal, or if you have symptoms such as bleeding after intercourse, it should not be done during your period, and you should avoid intercourse and using tampons or vaginal cream, gel, or tablets for 2 days before the test. The test is similar to having a pelvic examination. The doctor will insert the speculum to get a clear view of the cervix. The colposcope is then used to look at your cervix, although it does not touch or go inside you. A vinegar-like solution will be brushed onto the cervix, which reveals any areas where there are abnormal cells. This may sting a little but should not be painful. If there are any abnormal cells, the doctor can then take a small biopsy of this area and send it to the laboratory for analysis. The test might show that your cervix is healthy and you will be advised to have regular smears. Sometimes the biopsy will show abnormal cells, and this may need further tests or treatment. During the test, you will lie back with your legs supported. The test usually takes about 20 minutes. Thank you for your attention.
Let's now go to pathology of qi mechanism. Let's discuss entering and exiting of qi in joints. The joint capsules are also spaces or cavities where qi enters and from which it exits. The movement of qi in and out of the joints is controlled primarily by whatever channels course through the joint. However, it is also influenced by general by the liver because it controls all sinews, and the triple burner because it controls all cavities. If qi enters and exits from the joints in a balanced way, the joint will be free of pain and its movement unrestricted. In pathology, if there is excessive exiting of qi, the joint will be rigid, painful, and extension will be difficult. If there is excessive entering of qi, the joint will be weak, achy, and adduction will be difficult. Here you can see the entering and exiting of qi in joints. To summarize, the joints are cavities pertaining to the triple burner. Qi enters and exits from joint cavities, ensuring health of joints. Last, its excessive exiting of qi in joints will cause rigidity, excessive entering will cause weakness. Thank you for your attention.
Let's discuss stomach 45, Li Dwai, Hardberg bargain. Stomach 45 is located at the lateral nail angle of the second toe. It is a metal point, Chingwell point, sedation point. Hard bargain, Li Dwai, stomach 45, where the metal aspect of earth can be influenced, benefits the stomach official in many ways. Metal is formed within the earth and brings inspiration and quality to earth. Metal can help earth acknowledge its own harvest and be conscious of what it values. Metal helps earth know the limits of its work, distinguishing what is meeting the needs of earth and what is over-involvement in someone else's territory. Metal, with its clear notion of boundaries represented by the body hairs on the skin, can help earth draw back to the center, weigh up the situation, and regain reason. Metal helps Earth have a sense of purpose. Metal, as a conductor of heat and cold, can help regulate the climate within Earth and invigorate when there is inertia or an inability to accept and welcome others from cold. As the sedation point, stomach 45 can calm Earth if it has become agitated and over emotional. The stomach meridian started near the eye and ends here on the foot, though the exit point on the way level to its Yang Ming partner, Li, is at stomach 42. It traverses a long territory, working unceasingly with its partner, the spleen, to contribute to the maintenance of the five zang in our life. An alternative name, Sikh mouth, returns us to the head, near where the stomach started its meridian journey, as well as indicating one of the uses of this point, empirical point for hangover. especially with sickness. Stomach 45 calms the mind and spirit when they are disturbed with stomach heat, which agitates the heart and causes insomnia, restlessness, and disorientation. This point can calm the heart and the stomach. As a distal point, it affects the face and can clear stomach fire patterns affecting the eyes, nose, teeth, face, stomach, and skin. Treats disorders of the mouth, wry mouth, tooth decay in the upper jaw, and clenched jaw. As a Jingwell point, it can invigorate the circulation of qi and blood in the stomach meridian, affecting circulation in the feet and also the mind, improving mental dullness and congestion, as well as fullness or blockage in the body. Jingwell points provide a release for qi when it wells up from excess and are also used to release pathogens. Brightens the eyes, especially when stomach heat affects the eyesight. Clears the heart of heart fire. In this instance, it is used with direct moxa cones. Relieves retention of food. Indications: brings inspiration and purpose to mind and spirit, clears stomach fire, clears heart fire, releases heat and pathogens, insomnia from agitated Shen. Metal point, sedation point, Jingwell antique winter point. It is also known as the cruel payment point. We use this for first aid, indigestion, and hangover. Being the sedation point, this point can be used to calm the mind and spirit, effective for insomnia and agitation, problems of the mouth, particularly deviation of the mouth, or clenched jaws. Indications and potential point combinations. For severe toothache, tonsillitis, other orofacial pain, we combine stomach 45 with Li4 and stomach 5. Evidence-based applications. Acupuncture at stomach 45, bladder 58, stomach 40, 36, kidney 7, spleen 6, lung 9, Li4, lung 11, CV 17, Li1, spleen 1, heart 9, SI1, bladder 67, PC9, TH1, GB44, liver 1, and kidney 1, as well as moxa at GB14, resulted in rapid improvement in a 13-month baby suffering from staphylococcal skin infection after a poor 50-day response to antibiotics. Thank you for your attention.
Let's now go to pancreas and stomach. Let's discuss main functions. In Chinese medicine, the pancreas is usually called the spleen. This is due to a mistaken attribution of the organs in ancient times. However, the anatomical organ being referred to as the pancreas, and in this book I use the anatomical correct description of pancreas so as to avoid confusion when comparing this book's content with contemporary physiology. In contemporary physiology, the main functions of the pancreas are that it produces pancreatic juice, which contains enzymes that digest carbohydrates, proteins, and fats. These enable the small intestine to absorb the nutrients into the bloodstream. Next, it secretes the hormones insulin and glucagon to control the uptake of glucose, which is the body's main fuel. And it secretes the hormone pancreatic polypeptide, which is thought to produce the appetite. The Neijing authors noticed that when the pancreas function was poor, any of the following signs and symptoms could be present. Usually, not all would be present, but only a selection. If about three are present, this would usually indicate a diagnosis of poor pancreas functions. These are poor appetite, prefer to eat only small amounts, general weakness, and hence the tendency to avoid speaking and feeling tired after eating, abdominal bloating and discomfort, particularly after eating, excess gas, and frequent loose stools. There's also intolerances of certain foods such as dairy or wheat, poor sense of taste, cravings for sweet food, muscle of limbs are weak and soft or emaciated. There's also a tendency to bruise easily or have mild hemorrhages or purple spots or patches on the skin, blood In the stools, excessive menstrual flow or bleeding of the uterus, feeling a bearing down sensation in the abdomen, possibly with prolapse of the anus or of internal organs such as the stomach, kidneys, uterus, or bladder, and pain or discomfort anywhere along the pancreas or stomach meridian. People with this condition will tend to be habitual thinkers or worriers, and all the above signs and symptoms will tend to be made worse after extended periods of heavy thinking or studying. The facial color and tone of voice. In chronic cases, there may be a yellow hue visible on the face, and the patient would tend to have a singing tone of voice and may often hum or sing to themselves. Examination of the tongue and pulses. A practitioner would confirm the diagnosis by examining the patient's tongue and organ pulses. With poor pancreas function, the tongue would usually be swollen with teeth indentations on the side. The pulses are felt in three different positions on each wrist, each position providing information about the functioning of a different organ. This is conveyed in the quality of the pulse rather than merely its speed, and the possibility qualities could involve the width of the pulse, the firmness or tautness, the shape of the rising and falling, the strength, the depth, and so on, which with each quality indicating a particular type of malfunction in the corresponding organ. With poor pancreas function, most of the organ pulses would have a quality known as slippery. Other terms used for this condition in Chinese medicine, this condition may also be called spleen qi deficiency, which simply means that the function of the pancreas is poor. In contemporary medicine, the term IBS or irritable bowel syndrome is often used. Thank you for your attention.
Diagnosis by visceral organs. We continue with liver illnesses. Insufficiency of liver blood. Mainly, three circumstances lead to insufficiency of liver blood or liver blood deficiency. Insufficiency of spleen and stomach, so that digestion and absorption become inadequate. Massive blood loss, exhaustion by prolonged illness. Insufficiency of liver blood leads to loss of nourishment of the head, eyes, tendons, channels, nails, muscles, and skin. The main symptoms of liver blood insufficiency are dizziness or vertigo, pallid and lusterless complexion, emaciation, dry eyes with blurred vision, light blindness, numbness in the limbs, spasms of the tendons, dull nails, and tremors in the hands and feet. Women have oligomenorrhea with pale menses or amenorrhea. The lips and tongue are pale and the tongue coating white. The pulse is taut and thread-like. Deficiency of liver yin. The liver yin is unable to restrain yang, so that endogenous heat arises and gives rise to symptoms. Liver yin deficiency mainly results from three circumstances. One is frustration of the passions, causing blockage of liver qi, uh, which in turn gives rise to fire, and fire injures yin. Another is chronic heat illness consuming and injuring liver yin. The third is deficient kidney yin, disabling the kidney from supporting the liver. The water element failing to nourish the wood element. When liver yin is deficient, the liver is not nourished. At the same time, yin is unable to restrain yang, so that endogenous fire or deficiency fire arises. The typical syndrome of liver yin deficiency includes dizziness, tinnitus, dry eyes with blurred vision, burning sensation in the face, hotness in the five centers, recurrent fever with night sweats, dry mouth and throat, red and dry tongue, and a taut, thread-like and rapid pulse. Some patients have tremor of the hands and feet. Abnormal rise of liver yang. Liver yang can rise abnormally when there is deficiency of liver and kidney yin, so that yang cannot be restrained, Also, when the passions are exceptionally strong, there may be excessive dispersion of liver qi and unbalanced exuberance of liver yang, so that liver and kidney yin is consumed. Characteristically, this condition presents as exuberance in the upper body and deficiency in the lower body, or yang advance and yin retreat. The typical syndrome of abnormal rise of liver yang is as follows. There are dizziness, tinnitus, descending pain in the head and eyes, flushed complexion with red eyes, impatience and irascibility, aching weakness in the waist and knees, heaviness in the head with lightness in the feet, insomnia with much dreaming and forgetfulness. The tongue is red and the pulse is taut and forceful or taut and thread-like. Thank you for your attention.
Let's now go to advanced assessment of mental health disorders. Let's discuss mental status examination. The equipment needed are paper and a pencil, common objects such as watch, paperclip, and coin. Comprehensive mental status examination. The mental status examination includes assessment of appearance and behavior, cognitive abilities, emotional response, and speech and language. The assessment results may be obtained through direct questions and observations, and less obviously during other parts of obtaining the patient's history information. The mental status review includes several parts that reflect the ability of the person to interact with the environment. These components have also been called ego functions. The clinician should provide clear examples with any terms used to describe the patient to avoid the patient feeling labeled and stereotyped, and to ensure that accurate and truthful responses are obtained. The assessment of cognitive function is an integral part of the MSE. Impairment of cognitive processes can be indicative of neurological disorders, organicity, developmental delays, or signs of mental illness. A large portion of the assessment of the patient's cognitive abilities can be accomplished through the history-taking interview. For action, first, assess appearance and behavior. The information collected should be documented so clearly that someone who has not met the patient could easily identify him or her in a crowded room. Next is observe the patient for hygiene and clothing. The patient should display good hygiene and appropriate clothing. Patients with depression, dementia, and schizophrenia may display poor or lapsed hygiene. Patients with bipolar disorder may present with bizarre or inappropriate dress. Patients with dementia may also present with inappropriate dress. Next is note body size and stature of the patient. Patients with anorexia are often underweight. Anorexia may also cause growth arrest. Patients with bulimia may be slightly overweight, average weight, or slightly underweight. Dementia and depression may also cause weight loss. Next, inspect hair and skin tone. Skin tone should be even and consistent with ethnicity. Anxiety or panic disorder may present with flushing. Patients with anorexia may have a fine, downy hair on their extremities, trunk, and face. Next is note the patient's overall cooperativeness, hostility, or withdrawal behaviors. These all provide clues to mental health. Depression may cause a patient to be withdrawn. Schizophrenia, delirium, and dementia may cause a patient to be uncooperative or hostile. Second, evaluate sensorium, level of consciousness, which determines the patient's ability to participate in the interview. Levels of consciousness may be thought of in terms of orientation and responsiveness. Responsiveness reflects the activity of the subcortical reticular activation system, involving awareness of internal and external stimuli. Levels of consciousness may vary from alert, the normal finding, to coma. We see here the level of consciousness in tabulation. The alert, if there's alert, there's awake and spontaneous. If they're confused, there's decreased attention span and memory, or answers questions inappropriately. If there's lethargy, there's drowsy, falls asleep easily when aroused, and answers inappropriately. If there's delirium, there will be confused with disorder perceptions or decreased attention span and inappropriate reaction to stimuli. If there's stupor, uh, they would be slow to respond and can be aroused for a short period of time to visual, verbal, or painful stimuli. If there's coma, they would not be awake or alert, decerebrate, posturing to painful stimuli. Thank you for your attention.
Acupuncture for emergencies. This time we talk about coccydynia, acute tailbone pain. Acute tailbone pain or coccydynia is a common condition that can result from various causes. Causes are injury, trauma from falls or prolonged seating on hard surfaces, repetitive strain, activities that put pressure on the tailbone, such as cycling or sitting for long periods, infections or tumors. Rarely, infections or growths can cause pain. Symptoms: sharp or aching pain at the base of the spine, pain that worsens with sitting, standing, or moving, discomfort during bowel movements or sexual activity. Diagnosis is by physical examination by a healthcare provider. Imaging tests, x-rays, MRI may be used to rule out other conditions. When to seek medical attention: persistent pain lasting more than a few weeks, severe pain that interferes with daily activities, signs of infection such as fever or swelling. Use Do 20 and Do 19, shoulder back point, and Palyao point. Use bladder 25, Palyao bladder 54, and 60. Use Do 1, Yao Chi, Do 2, 3, bladder 40, and Li4. And use bleeding therapy on bladder 57. Thank you for your attention.
Let's now go to fibromyalgia. Let's discuss regional acupuncture treatment for arms and legs. For arms, the muscle channels influencing the arms are the large intestine, triple burner, and the small intestine muscle channels. And the superficial and deep muscles are as follows. The regional acupuncture treatment for arms, the small intestine, if it's superficial, it's in the extensor carpi ulnaris, triceps brachii, and deltoid. For deep, it's in the flexor carpi ulnaris and supinator. Next is the triple burner. If it's superficial, it's in the extensor digitorum, extensor carpi ulnaris, extensor digiti minimi, anconus, triceps brachii, and deltoid. If it's deep, it's flexor digitorum, profundus, extensor indicis, abductor pollicis longus, and supinator. The large intestine, if it's superficial, it's in the extensor digitorum, extensor carpi radialis longus, extensor carpi radialis brevis, abductor pollicis longus, brachioradialis, brachialis, triceps brachii, and deltoid. For deep, it's in the extensor pollicis brevis, extensor pollicis longus, and supinator. The strategic points to be used are SI3, triple burner 5, triple burner 7, triple burner 8, triple burner 14, Li4, Li10, Li14, and Li15. Next is to go to the legs. The muscle channels influencing the legs are the stomach, spleen, liver, kidneys, gallbladder, and bladder muscle channels. In fibromyalgia, the tender spots are usually on the yang rather than the yin channels. The superficial and deep muscles of the yang channels on the legs are as follows. Here we can see the points of the legs for fibromyalgia. The regional acupuncture treatment, the legs and bladder. For superficial, it's in the gluteus maximus, gluteus medius, biceps femoris, semitendinosus, semimembranosus, gastro, gastrocnemius, quadratus femoris, plantaris, popliteus, tibialis posterior, and flexor hallucis longus. For deep, it's piriformis, abduturator internus, gluteus minimus, gemellus superior, and gemellus inferior, and soleus. The gallbladder, if it's superficial, it's in the gluteus maximus, gluteus medius, tensor fascia latae, peroneus longus, peroneus brevis, peroneus tertius, gastrocnemius. For deep, it's gluteus minimus, vastus lateris, soleus, extensor digitorum longis. For stomach, if it's superficial, it's in the rectus femoris, vastus intermedius, vastus lateralis, pectineus, adductor longus, sartorius, tibialis anterior, extensor digitorum longus. For deep, it's in the psoas minor, psoas major, iliacus, adductor brevis, adductor magnus, extensor hallucis longus, and quadratus lumborum. The strategic points to be used are bladder 40, bladder 58, bladder 57, bladder 60, gallbladder 30, gallbladder 31, gallbladder 34, stomach 31, stomach 32, and stomach 36. Thank you for your attention.